By listening to this podcast, you agree to not use this podcast as medical advice to treat any medical condition in yourself or others, including, but not limited to, patients that you are treating. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast. Under no circumstances shall any guests or contributors to the podcast or any employees, associates, or affiliates of the Neuroendocrine Cancer Awareness Network be responsible for damages arising from use of this podcast. Welcome, everybody, to another episode of Nets Get Real with NCAN. I am your host, Mike Wayman, and today we're going to focus on our next conference, which is February 17th in San Diego, California. We're going to be going to the Holiday Inn San Diego Bayside. We have 5 amazing doctors scheduled. We've got Dr. Aman Chauhan, Mary Maluccio, Heidi Del Rivero, and Dr. Alexandria Ganji. And we also have Dr. Mike Demeure. Welcome to the show.
Thank you very much. Appreciate it.
If you guys don't have the information on this particular conference, you can get your registration and everything done through netcancerawareness.org. And Dr. Demeure is a surgeon out of the Hoag Medical Center in California. And you're going to be covering a little bit about endocrine surgery.
Yeah. So, I'm looking forward to the event and sharing our thoughts. We have a program that's really multidisciplinary, and I lead it. But my clinical interest is 100% endocrine surgery.
Absolutely, that's great. Now, what kind of led you to the world of NETs?
Go way back. I was interested in cancer surgery from when I was a resident, but I wanted to stay in academics. And back in those days, it was you're up or out, in terms of the old tenure days and everything like that, which fortunately has changed. But I realized that during residency, nobody really taught me to do research. So it was a little bit of a happy accident. I went to work with Orlo Clark in UC San Francisco. He was an endocrine surgeon, one of the sort of grandfathers of the field. And he was doing research in thyroid cancer, so that's an interesting cancer research project, but really started me down that road. And then I got a faculty job at the Medical College of Wisconsin with Stu Wilson was my senior mentor there and partner. And he did a lot of the pancreas cancer surgery as well. And so, as that 4 or 5% of the pancreas cancers are neuroendocrine tumors, the rest are adenocarcinoma. But, so we did a lot of both because there's probably not enough. If you're a pancreas surgeon, there's not enough pancreas surgery to do if you only do neuroendocrine. But we ended up doing a lot of it. And then, my research interest really came from the patients I see in the clinic. We're interested in patients are great teachers if you open your eyes and open your ears.
That's actually a really amazing outlook on your pursuit to medicine, because that's something that we kind of, as advocates, we kind of try and bestow upon our, anybody who comes to a conference, comes to one of our NCAN events all over the country, is that your doctor is also learning from you, and it's really important to have that connection and that communication between the two of you. Absolutely. So I believe you've done a conference with NCAN before, if I'm not mistaken. It was quite a while ago.
We've spoken to a few of the advocacy groups. I'm not quite sure. Yeah, a few years ago, and we were up in LA, I think, or something, right?
Okay. Yeah. I do believe that's where it was. So why do you think it's important, not even just for patients to attend these events, but the doctors to be attending these events and presenting this information, in your opinion?
Well, I think we're in this journey together. We all want to make progress. I can tell you one of the most gratifying things is when something that we've done on a research side turns around and helps a patient. and it just kind of is really what makes us tick, in terms, at least for me. I'm thinking one patient that had a kind of rare cancer that, based on some work that we actually did on cells and in mice in the lab, we identified a drug target, and then we brought a clinical trial targeting that drug, and the patient had disease all over his abdomen, stage 4, out of standard of care options, and he had a remarkable response. And that was about 8 years ago now, and every Christmas I get an email that says, "Doc, I'm still here." So, I mean, that is incredibly gratifying to get those. And so we're in this journey together, and, we can't promise that for every patient, but, if we work together. So I think the best thing for us is, we want patients to go where there's experts. As you know, one of the problems with patients with rare disease is to find experts, and very often you have to travel. And I think patients in Southern California in particular may not know where the experts are. I think that they have to go somewhere far, but, we're a local hospital that we would like you to know about the things we've built at Hoag. And so try to get the word out. We have clinical trials for patients with advanced disease. We just had a clinical trial here for an oral somatostatin analog patients with carcinoid that we put some patients on, and that's a local Southern California company that's based in La Jolla that has this agent, and we had the trial here. But instead of getting a monthly shot, so the trial's closed, unfortunately, but we want to get the word out, and we're talking to them about additional trials. But we want to get the word out about local resources that you may not know about as patients. So that's one of the big things for us, and why we want to reach out to the groups.
Yeah. And actually, I do believe that at this conference, we are going to be talking a little bit about the clinical trials, and including that particular clinical trial as well. I think it's huge. I think it's huge that when patients don't no longer have to give themselves shots, and it's just a quick oral pill. I think that's a life changer for sure.
Well, let me tell you, we have, for example, open clinical trial, which is available, is a new drug. So, everolimus is approved for neuroendocrine tumors of the GI tract, of pancreas, but we have a new formulation which we think is likely to be better. It's called nab-sirolimus, another Southern California company, but from Addy Biopharma or Biosciences, Addy Biosciences. But we're looking for patients, for example, that have refractory neuroendocrine cancers that we can put on that trial. It's open and available at Hoag right now.
That's amazing. That's amazing. Now, in terms of, so from a doctor's perspective, why it's important, and what you get out of the conferences, that, again, that connection and stuff. Why do you think it's important for patients to attend these conferences? I mean, you get that FaceTime sometimes with these doctors, world renowned doctors from all over the country. What in your opinion makes it so important for a patient to attend something like this?
Well, I think there are a couple of things. There's a lot of misinformation out on the internet, and people get their resources there. So to get the straight truth, if you will, or at least the best we can, is important, because there's a lot of what's on the internet is marketing, and people are spending a lot of money to go somewhere where you find you don't have to. You can get expert care locally. That's one. Two is just to find out and make sure that, again, rare diseases expose special challenges, to make sure that you have somebody that has seen what you have before and is taking care of patients. And, said that becomes very important, especially if we want to get good outcomes. I think it's been pretty well shown in a lot of cancers that, people that get care from people that are experts in their disease tend to do better. So, for example, I can't tell you how many patients I see that have carcinoid syndromes that have not had an echocardiogram. Wow. It's very important that, if you're a doc that's treating that, you know that you can get carcinoid heart valve disease, and you get a screen for that. So it's, again, those kind of things, dietary resources that are available. If you're not, if you're not taking care of those patients regularly, there's just things you may not know. So I think it's important for patients to know that. I think if we're smart as docs, we listen, because we also learn from our patients, about, some of the things they're going, and patients have told me about resources that they have found, for example, sources to learn about carcinoid diet, for example, the foods to avoid and things like that. Medications might alleviate other symptoms. So, I think, again, patients are resourceful, and so very often they'll teach us things. So I think it's a real important to have that interchange, if you will, and us to learn from the patients as well.
Sure. So going back to the, stepping away from the event itself for a second, why do you feel, I mean, your specialty is more surgical and stuff, but as a surgeon, why do you feel it's important for a net patient to be very involved with their treatment?
Well, again, it's a partnership, and again, the patients, I guess probably nobody has as much an interest in having a good outcome as the patient and their family, right? So, having the right operation is important. Understanding, for example, very often the surgeon is the first patient that sees certain neuroendocrine tumors. The patients have a genetic risk for having other tumors, or having, an increased risk for an inheritable disease that then their kids or their brothers and sisters, parents might also be at increased risk for. So important that the surgeon knows that and refers the patients over to a genetic counselor for proper evaluation for genetic risks. We're talking about things like if you have a pheochromocytoma, every one of those patients patient with a pheochromocytoma, so you should see a genetic counselor, because about 40% of the time there is an inheritable component to that disease. They could tell you, well, maybe you're also at risk for medullary thyroid cancer, for example, or kidney cancer, for example, or pancreatic tumors, for example, if you have von Hippel-Lindau. So all those things are really important to have a proper evaluation, and the surgeon very often is the one that sees the patient first and initiates that workup.
Absolutely. And just one more thing about this end of it. What, for a new net patient, what do you think is the number one thing that they could do going into, after they're diagnosed? What do you think the most important thing to do next is?
I think you need to find a physician that treats patients with neuroendocrine tumors, ideally closer to home. So, because nobody really wants to travel far if they don't have to get good care. And then understand and have an understanding that for most neuroendocrine tumors, at least that we see, we're looking at hopefully a long-term process. Even people with advanced disease can live for many years. So it doesn't have to be, quote unquote, a death sentence. Even if you have stage 4 disease, we've had patients live for many years. And and also understand that we have lots of options for treatment, and that we can, I make the analogy of, we have lots of arrows in our quiver, and we have to figure out when to fire which arrow to the best advantage, with the idea that hopefully we're going to have a long-term relationship, and that, we'll keep patients hopefully with a good quality of life for many years through the various options that we have, and understand that we are developing new treatments all the time. Just put in maybe one more plug for Hoag while I'm thinking about it. When I got here, we really didn't have a multidisciplinary team. I've been here now almost 7 years. Lutathera, which is the peptide receptor therapy, that's the IV radioactivity that we talk about that binds to these tumors, was approved, I think, in January of 2018. We treated our first patient in March, so we were able to really get going quickly. But because of that, and now PSMA therapy for prostate cancer, the liquid radiation, if you will, has become really growing, if you will, as far as the number of patients treated. Hoag has now developed a specific clinic where patients have a nice room with a chair and an easy chair and a TV screen because it's a few hours so you're spending there, but a dedicated facility for giving the liquid radiation. There's also doing clinical trials for patients that have progressed, their tumors have progressed on Lutathera, for example. We have a clinical trial with actinium dotatate. Actinium is a stronger alpha particle. So while the lutetium-177 is a punch, the actinium-225, we said it's like Mike Tyson's punch, to those tumor cells. So it's a stronger radioactivity particle. And so those kind of things. So if you find a center that has got devotion and dedication to neuroendocrine, you'll have care, expert standard care, but hopefully then also access to new therapies that are in clinical trials and things like that. So I think that's the important. Find hopefully experts that are devoted to treatment of patients with neuroendocrine tumors, hopefully close to home.
And we've you've said it multiple times on this episode, and we say it all the time on this show and at every single patient conference, is multidisciplinary team. That's huge that you need to find that as close to home as possible. Hopefully if you do find something that is a little further away, your local doctors are willing to work with those doctors that are a little far away to kind of keep you comfortable, keep you going and treating this for sure. So Dr. Demeure, thank you so much for joining us today. I'm really excited for San Diego. I'm excited you're going to be presenting in the morning. Again, he's going to be presenting on endocrine surgery. We spoke a little bit before we started recording this about the expectations of the slideshows. I wouldn't worry about it. We have Dr. James Howe. He always gets us flagged on YouTube with his presentations that we have that 18 and over check mark on his presentation. So
well, Jim and I just published a paper together. We did genomic characterization, the genes at the DNA and RNA level of primary metastatic carcinoid paper. We published that together just about a few months ago. So I like Jim. Jim's a friend, so good doc.
Of course. If you could send me that link, I'll actually put that down in the description here. A link to that paper. Be happy to put that in the description down here lower. And once again, guys, February 17th, San Diego, California. NCAN is finally getting out to the West Coast. We're going to be at the Holiday Inn, San Diego Bayside. We've got 4 doctors plus Dr. Mike Demeure presenting. It's going to be a great day. I'm excited. I always love the Q&A, the expert Q&A panels, because especially when you get different doctors with different modalities of treatment, you get a little bit of fun sometimes. So I'm excited for that. And if you need a little bit more information on all these things that are happening, go to netcancerawareness.org. The events page will show you all of the events that we have coming up. We have the one in California. We have one in Iowa in April as well with Dr. Jim Howe as well, the winner of the Dr. Odoricio award last year. And hit us on all the social medias as well, at NetCancerAware. And until next time, we will see you on Nets Get Real. Have a good one.
Bye. Thank you.